Good morning, everyone, and welcome to this Malnutrition Awareness Week webinar. We are focusing on nutrition literacy for change, empowering patients to take action. That's our title. My name is Ole Lundqvist. I'm the chairman of the European Nutrition for Health Alliance, and I am very happy to share this session alongside Karen Castrati from the Nierenkrebsnetzwerk. I think I got that right. And we just like to welcome everyone to this event. Karen, you want to say a few words?
Yes, thank you, Ole. Yes, it's the Nierenkrebsnetzwerk Germany. It's the kidney cancer network. So I'm a patient advocate for kidney cancer patients. And welcome, everyone. I'm happy to be here, and I'm happy to see that many people in the room. Let's get started.
Yeah, we have a fantastic program for you with some initial words from Joost Wesseling, who is the executive director of the NA. We have a few talks about from patients and patient representatives, and then we're going to have a discussion. So I think we can get going, and I'll hand over to Joost to tell us about the need for a powerful structured approach.
Joost, you're on mute.
Mute. Thank you very much, Ole. I will first give you the floor for a few slides on Anna, and then Karen will follow up, and I will say a few words on the patient integration of in Anna. Can you see the slides?
All right. Yeah. Okay, we can go to the next one. Well, malnutrition is a much bigger issue than most people actually realize. There have been studies showing that more than 30 million EU citizens are at risk of malnutrition, mostly because of chronic disease. And malnutrition impairs the quality of life and also impacts survival time. This has been well known for many, many years. In hospitals, every fourth patient is at risk of malnutrition, and 10 to 20% of cancer deaths are attributed to malnutrition itself, not the cancer. And the cost is estimated to be sky high, 170 billion annually for Europe alone. So next slide. If we can move to the next slide. Yeah. So the European Nutrition for Health Alliance is a group of people. It's a stakeholder organization with the aim of translating the science, everything we know, the facts about nutrition, into policy and practice. And we really focus on how to help produce better policies to make sure that they align with the science so that patients get the best nutritional care that's available. Next slide, please. The way we do this is approaching both at the EU level, and we had a session just a couple of days ago at the EU Parliament with the Vice President of the DG Santé and other stakeholders discussing how to move this forward. But we also do it at the national agenda with helping form stakeholder groups from all kinds of starting points to really address these issues and have these two levels actually merge with each other and go back and forth so that we can get policies at the EU level that trickle down to the national levels, but also pick up good things from the national level up to a higher level and then spread it out. So we can go to the next slide. So it's a unique multi-stakeholder alliance with a lot of stakeholders involved, many professional societies involved in this, and also several patient organizations and others. So please, next. Of course, behind it is the ESPEN network, which is the scientific basis, the best clinical nutrition medical society that's producing the clinical science. They are based with us, and together with them, we work in many different countries. And this week, we are running 17 malnutrition awareness weeks across Europe in all these different countries. And I would recommend all of you to actually take a look at our homepage, where you can find all these different events, and you can see how dedicated many countries are to raising the awareness of malnutrition. Next slide. So our call to action is really to integrate nutritional care into health policies to improve both outcomes and quality of life. And the reason for this is that in many countries, the nutritional part of the care is not really treated at the same level as the pharma companies or the pharma treatment that is given to the patient. So we really need to put all of these things together, because they are at the same level of effectiveness in many cases. So I think that was leading into, I think I'd like to present then Karen, right?
Yes, thank you. Thanks for this overview and the information on the Malnutrition Awareness Week. This year, we're focusing on nutrition and literacy and empowering patients. So I would just like to say a few words why empowering patients is important. The next slide, please. We do see that patients are often left alone when it comes to nutrition, but there's a high need when it comes to nutrition. As you already heard, malnutrition prevalence is high in patients, especially cancer patients. So there's a need for information and dialogue between patients and healthcare professionals. We often see that it's not the patient that doesn't want to take part in their care or doesn't want to be involved, but it's often that they don't know what questions to ask, what nutrition really means, what it's all about, what does it have, or what impact does it have when it comes to your disease? Why is it important? So we see that nutrition and literacy is key. We need to be equipping patients with information. We need to empower them, to give them the confidence to seek information, to talk to their patients, to talk to their healthcare professionals, to take action together with the care team. And we would say that nutrition is not an add-on when it comes to your care journey. It's a part of the care. Next slide, please. But the reality is a little bit different. We see a lot of barriers that patients face. One is the information gap, or the nutrition and literacy gap, which we want to tackle this week. Nutritional advice is often very difficult to understand. It's confusing. When you jump on the internet and look for information, you get very different information with different quality. There are a lot of people out there that are just talking about nutrition with no evidence. So patients are getting a lot of wrong information. They don't know what is real, what is not real, what they could follow, what not. Information is inconsistent, and sometimes it's also too complicated. We know that health literacy is not very high in some of the European countries. At least that's for Germany, that's the fact. I know that. So we need to have information that's very low key to inform patients in their own words, so they know what we are talking about. And there's also a confidence gap. Many patients don't feel qualified to bring up nutrition with the professionals. They're scared, or sometimes it's just like the HCP is sitting there with the white dress and they're just talking to them about the disease, about other medications. So they feel like a little bit small and don't want to speak up for themselves. And then, of course, we have the system gap, where time pressure is high. We don't have time. A lot of people are queuing up in the waiting room. So nutrition is something that is not touched in the discussion, or not touched early enough. And these barriers leave patients feeling unheard and undernourished, both physically and emotionally, I would say. Next slide, please. So nutritional literacy could be an opportunity, could be a bridge. Nutritional literacy is more than just understanding what to eat. It's to know how important nutrition is among the care journey. And when patients understand their nutritional needs, they become active partners in the management of their disease. They don't just sit there and get passive advice. Nutrition literacy helps to improve the communication between patients and professionals. They speak the same language. They're on the same level about nutrition. Patients feel safe to ask questions and make informed choices. And I would say it's also a matter of equity. Every patient, regardless of the background and the education, should have access to tailored nutrition information. So call for action. What can we do? I think this Malnutrition Awareness Week is a good start. The campaign reminds us that nutrition care is shared care. Doesn't come from the HCP or the patient. It should be dialogue between both of them. So we need to speak the same language, as I already said. We need to include the patients early, make nutrition a part of everyday care plan and not an afterthought. And we need to build confidence. We need to equip patients with tools to ask, how is my nutrition part of my treatment? So let's make nutrition and literacy a right, not a privilege for the patient. Thank you. And with that, I would like to give the word to Joost Wessling, the Managing Director of the NHA Alliance.
Thank you very much, Karin. I think you explained extremely well the key importance for nutrition patients and nutrition. Let me explain a bit how this would relate to the activities of the European Nutrition for Health Alliance. Because within the Alliance and also with its ONCA, its Optimal Nutritional Care for All campaign, an integral approach is key. So it's a multi-stakeholder activity where everybody comes around to the table, because this is where the meeting point is. And obviously, the patients come first in this. So within the campaign, we've always included both European patient organizations as patient advocates from the country. And this is also what you can see as an example from the Danish ONCA team there, where you can see that it's doctors, it's dietitians, it's people from the government, but first and foremost, it's the patient representatives that should be centered and a key part of the ONCA teams. However, also at the European level, we try to focus on that, and we say it should be patient-centered medical care. It's really important in nutrition care. So we really try to also include that in policy. But what we still needed was an integral approach to that. Professor Lundquist just mentioned this. The day before yesterday, we had a meeting in the European Parliament. All stakeholders involved, doctors, patient policymakers. And obviously what makes the big difference and what makes things tangible is the input from the patients. It's their stories that actually basically convince also the policymakers and even the doctors how important it is to put the patients first. So within ONCA and ENA, we've been so active trying to integrate the patients within the campaigns. But what we also wanted to do is have the more structural approach. So not going from event to event, but basically saying we need a structural approach in all our activity, in all our policies, all our plans. There should be patients come first. And so what we came up with is a patient and nutrition impact group. And today marks the launch of that group. It is still a beginning. What we aim for is that we have all these countries and more who are involved in the ONCA campaign and the European Nutrition for Health Alliance, that they all support patient advocates to be part of all the activities. And what we will do in the run-up to the Nutritional Care Policy Summit in Paris on the 1st of June is work on the governments, the manifesto, and also a work plan for the group. So today is kind of a kickoff also, marks the begin. But now actually the work needs to be done to make a structural approach to the patient integration for the longer term. And my call to action to everyone listening to this and viewing this webinar is really to support patient involvement in all campaign activities. So also from within the countries and also at the European level. So again, if I may echo Professor Lundquist quote, we need to integrate nutrition care into health policies to improve both outcomes and importantly, and still often forgotten, quality of life is key in this. So thank you very much.
Yes, thank you, Joost. So I think we will be starting in the talks from the patients and patient advocates. The first one will be Marek Lichota from Appetite for Life. He's a patient himself, and he will be talking about unmet needs in intestinal failure. Marek, the floor is yours.
Good morning, everyone. I hope that you can see my presentation.
Yeah,
yes,
all good.
Okay, perfect. So let's start. As you just heard, I believe we all need a success. And some says, I mean the success when it comes to the Malnutrition Awareness Weeks, but especially when it comes to the implementation of the nutritional care within this kind of context. And many says that sometimes the success is built on a failure. And my personal story is also built on the failure, but in this case, intestinal failure. To be honest, based on my personal experience, I'm perfectly aware how important such a proper nutritional care is within the context of the patient status, but also how life-threatening it might be when there is a lack of the nutritional care. So therefore, I'm so determined, but also acting when it comes to the raising awareness of that issue. And I'm also happy to give a speech today about this topic. Sorry. But let me briefly introduce you what the intestinal failure is. So when the bowels are not able to absorb enough nutrients, water, but also electrolytes from the food to keep the body nourished. Because of this, there is a need to supplement this somehow. And it is given directly by the veins intravenously. But what's the most important is the fact that, as I said, intestinal failure can be a life-threatening. Without the proper IV parenteral nutrition, with the proper support or the fluid support, people's life is in danger. So that's why it's so important to take an actions to inform and to cover that kind of issues with the solutions. So I was really pleased to be a part of such a program together with the other stakeholders who defined the 6 urgent unmet needs which needs to be covered when it comes to improving standards of the chronic intestinal failure. Let me just briefly introduce those kind of things which we need to address. So first of all, there is still an inequality in access to treatment. Let me just briefly show you the picture how I look like in the worst moment of my life. And unfortunately, still people die not from the disease, but from the malnutrition and exhaustion. So that's also a situation in Poland and also in Europe. And sometimes, unfortunately, the healthcare system fails to provide a timely and adequate nutritional care. And that's the pity that sometimes people's life depends more on financial and administrative decisions than on the medical needs. So yeah, that's the case and that's the situation. We cannot agree for this, and we have to fight for the better recognition for the problem. Finally, to address that kind of issue, we need to disseminate agreed epidemiology and the quality standards. In Poland, we are still struggling when it comes to the intravenous nutrition for pumps, and we are asked to give strict data what kind of population does this problem affect. And it's so hard to define because there should be a clear epidemiology data behind the chronic intestinal failure. In such a cases, because it's not just the population of the home enteral or home parenteral nutrition patients, there are many others. So we need that kind of data to also inform the other about the scale of the problem. Let me also move forward. We need to have a proper understanding First of all, the understanding also from the others that the intestines can fail just like a heart failure, just like a kidney failure. But we need to also learn from each other. I mean, between all the stakeholders, between the physicians and the patients and the industry, but also with the policymakers to let them understand how big impact does that kind of intestinal failure has got on the patient's life. Let me move also to the home and social care, and there is also inequality. Let me use the example of two rivers which merge in one stage, and both of them plays essentially the same role, but the quality of life of organisms living in those rivers are completely different. And we can refer this to also the care over the patient with the intestinal failure, that the system might work, but it might be completely different. And probably I do not have to ask you in which one you prefer to live. So therefore, I was so happy to see and to notice the new publications which measures the quality standards in the chronic intestinal failure. Of course, it refers more to the quality of care, but definitely the quality of care within the IF also impact the quality of life. If there is a psychologist, dietitian, how complex, what kind to the reference centers. That's all the aspects which needs to be taken into consideration. And also, it's worth to compare those standards between the countries and also motivate the others to achieve the better standards of care. Still, there is an inadequate research to drive the service improvement. I believe that, of course, it's partly, let's say, true. Nevertheless, when it comes to intestinal failure, I would be really, I know that there are a lot of data, a lot of studies are already given, but still a lot to do. And also, that's what I would like to underline, also to engage the patients. Recently, I also had the pleasure to give a speech what kind of research can be run, but from the patient perspective. And sometimes the aspects and the stress might be put on a different things, which has a broader or a more significant impact on the patient's quality of life. And finally, there is a lack of accredited reference centers. We really don't know, especially in the beginning of our diagnosis of our pathway, where we're supposed to reach out to, how to find the reference centers. It impacts the fact that that kind of pathway is prolonged, delayed, and sometimes, unfortunately, people do not achieve final support. So if we can make this process smoother and define the reference centers, that it will be significant value for the patients. To address those issues, we just wanted to point out we decide to run the Life Leading Intestinal Failure Equality Initiative, which again is composed of different stakeholders, the physicians who are experts in the intestinal failure, but also the dietitians, the pharmacists, the nurse, but also the patients. So that's the case how we can work together. And how we can also advocate for equal access to the diagnosis, treatment, nutritional care, all the aspects which I already pointed out. But also we strive to drive and collaborate and educate through the actions like a 1F Day, to which I would like to welcome and invite you, if please join us on the 1st of February. Very soon on the 19th of October, but also in the December, we will organize 2 meetings for the 1F Day ambassadors. You are more than welcome. Just send me an email. I will share my data at the end of the presentations, and that's the case how we can make the change together. But finally, any change won't be possible without you. So as an NH patient in the nutrition impact group, that's at the moment that these are just 3 of us who really wish to make a change, but we really need you. There is no group. That's the creation phase, and definitely to turn the nutrition literacy into actions. That's the time for you. Even the better ideas, the brightest passions means nothing without the people. So therefore, please be the change. Join us for a better nutritional care. So thank you so much. I leaving my floor for the others. Please take a note of my email and reach out to me within for the Intestinal Failure Day, but also in regards any other aspects. Thank you so much.
Marek, thank you very much for this wonderful presentation. Very clear and structured, like always. Now I'm going to move over to Karen again, who will talk about the cancer patient survey results.
Yes, thank you. It's me again, back with cancer patients, as I'm a patient advocate for cancer, so that's my field. We did a survey on nutrition and cancer among people affected by cancer, of course. So why did we do this? I mean, we already heard that nutrition is a big aspect for patients, for cancer patients as well. It's not only fundamental component throughout the therapeutic journey, but it's also some point of normality. I mean, when you cannot eat right, when you cannot sit down with the family to eat, that turns your life upside down. So it's really important for patients. We already heard that it helps to improve the physical condition, helps to undergo treatment, better tolerate side effects. It also supports the body's ability to cope with illness and maintain strength. But we also know that it's often overlooked, leaving patients and their families alone with doubts, questions, and need for practical guidance. So we wanted to hear from the patients what they think, what they see, what their problems are. We wanted to evaluate the current situation and, of course, identify possible gaps in care and optimize treatment. The aim of the survey was to gain a better understanding of what patients experience on a day-to-day basis and the questions they have on nutrition in everyday life. So what did we do? It was a patient-led survey, so patient-initiated survey. That's really important for me to mention because that's not very often that we have patients taking action instead of HCPs. So this was a survey initiated from the European Cancer Patient Coalition, which sadly doesn't exist any longer, but there are others out there, and our German Kidney Cancer Network. But of course, we had experienced professionals on board as well. We had Professor Muscaritoli from Rome and also experts from the University of Jena in Germany. And of course, we had the ONCA team on board. We had an anonymous online survey with a questionnaire that consisted of 46 questions. That was quite a lot. And I think maybe it was too much for some patients to handle, but it could be broken down in a few sessions, so you didn't have to do it in one piece. So we had questions from demographics all the way through questions on nutrition and weight loss, access to timing in nutritional care, and the importance patients place on nutritional care. The survey was circulated online via European patient organizations, and the data were collected from April to July 22. So data's already a little bit older, so maybe we could aim for another survey next year. That could be a project we could do maybe. All in all, we had about 1,000 people with cancer who participated in the survey. The mean age was 55 plus minus 14 years. And the results echoed what we could see in literature before. So it's 4 in 10 patients experienced serious eating problems like loss of appetite, nausea, diarrhea. Yet 2/3 said their care team rarely or never asked about feeding issues. So the problems are there, but patients are not asked actively by HCPs. About 70% felt their oncology team does not take care of nutrition at all. And 80% said nutrition problems negatively affected their quality of life. But only 1 in 5 were referred to nutritional specialists. So we can see that there's a gap. People are suffering, the nutritional problems negatively affect quality of life, but they don't get help. They're not referred to specialists. But also 70% believed that access to clear, trustworthy nutrition information would have helped them in their cancer journey. So these results tell a clear message. Patients are suffering due to lack of nutritional care. What can we do? We do know that there are guidelines on nutritional care for cancer that includes screening and assessments, but it seems that this is not done in everyday life. And we also know that healthcare professionals need to be aware of the problem, that we need to make them aware that patients are suffering and what they could do to help. But coming from the patient side, being a patient advocate, we wanted to look into the patient side. What can we do from the patient side? So we found that improving health literacy, nutritional literacy could be key. So we did a small study in Germany, just 23 patients, so nothing spectacular, but we wanted to find out if nutrition-related health literacy could be improved via online seminars on nutrition. So what we did, we gathered the group of 23 patients around us. We had a pre and post-test online survey evaluating healthcare, health-related literacy. So we could know if they already know about the disease, if they can understand information, and so on. Afterwards, we did 2 online seminars on healthy eating, like overall, nutrition specifically for cancer and kidney cancer. And additionally, we did a training on health literacy, how to improve health literacy, how you can find information online, how this is important to evaluate information you find on the internet, if it's real, if it's not, if it's trustworthy. And the results were pretty clear. After the training, 65% of the participants showed a trend toward improved nutrition-related health literacy. Remember, they did the same survey after the education intervention as they did before the intervention. So 60% of the patients showed a trend towards improved health literacy. And in approximately 22% of these patients, the improvement was statistically significant. After all, patients reported being able to find, understand, and apply nutrition information more effectively after the training. And patients rated the training very positive. They were asking for additional sessions over a longer period of time. So this could be a model maybe we could adapt for cancer patients. In Germany, we do have that for diabetes. Diabetic patients get a training that the costs are covered from the healthcare system, and it's over a few weeks. So they learn on nutrition, how to implement nutritional information, how to find good information. So this could be a model for cancer patients as well. The learnings: nutrition is fundamental for cancer patients. It plays an important role in everyday life. It helps improve the physical condition and enables patients to undergo treatment while better tolerating its side effects. But patients do report a gap in nutritional care. And we think structured nutrition and health literacy trainings could improve patients' knowledge and thus the patient's well-being. So thank you. And I want to echo Marek's voices that we need to take action and that it's good that we want everyone out there to join us, all patients that are out there, to join our network and to join our impact groups so we can make a change. Thank you. So now I think the next one coming after me is Vera Gomez.
Hi, good morning. My name is Vera Gomes from Associação Crónica de Portugal, so an IBD, inflammatory bowel disease patient organization. And I would like to start with a very simple message. If public health or care policies on nutrition don't include patients in their design, they will fail in their implementation. For patients, nutrition is not just about food, it's about how function, is about dignity and control. At least in Portuguese culture, we live around food. Food is extremely important for us. It's a social moment. So when patients are impaired by their health condition to have a normal meal, this has a huge impact outside the medical office and the medical cabinet. And as an IBD patient myself, I can stress that we live every day negotiating what our bodies will tolerate when we need to eat. So that's why policies designed without us, patients, often miss reality, what is happening in real life outside the medical office. So you hear about policies and policy care, nutritional care, and they talk a lot about balanced diets or recommended foods. but that they ignore actually that healthy diet is about ensuring healthy nutritional status. And they ignore, for example, that many patients can tolerate vegetables or cannot afford specialized products. So yes, scientific evidence is essential, but lived evidence is equally valuable. So patients bring the real world perspective that makes a policy sustainable. So in Portugal and in many EU countries, nutritional care is still fragmented. We have excellent professionals, but we do not have an integrated national pathway for nutritional support. Especially in chronic diseases like inflammatory bowel disease, we live this on a daily life, daily life. It's a common question that we have, but we don't have straight access to this nutritional support. So malnutrition screening isn't yet systematic. So access to clinical dietitians still depends on postcode or insurance in some of the countries. And the cost of nutritional products often falls entirely on patients. And for example, in Portugal, there were some changes this year, but it's still not doesn't still ensure equity. So this is not just about a clinical issue, it's also a policy gap. And let me offer some examples of what can be done for ensuring actionable priorities to make nutritional care a real part of public health policy and nutritional care. I will start with one example. Make nutrition a fundamental right in chronic disease care. Include nutritional assessment and counseling in national health coverage, not as an optional extra, but as a standard of care. When something is in the policy, it gets funded, it gets tracked, and it gets delivered. Second idea is institutionalized patient participation. Make sure patients are involved. Patients shouldn't be consulted at the end of the process. We should sit on the committees that design the nutrition strategies with voting power, not just a symbolic present to tick the box. Our role is to say, this recommendation sounds good, but it won't work for people on a limited income. Or this tool is too complex for real life. And Karen just mentioned a few examples that goes into this point on her presentation. So involving patients is how you turn good intentions into a workable policy, one that is really implementable. And the third point that I would like to bring to your attention also is nutrition policies must account for social inequality. It's not fair to recommend special foods if they are unaffordable or they are not available. So public policy on nutrition care, they have to link healthcare, social support, and education so that eating well isn't a privilege, but it's actually a public right. And this enters where patient organizations can help. Patient organizations are bridges between the policy and the practice. We can help policymakers, we can help healthcare practitioners understand the gaps where people are falling through the cracks. We can co-create education materials that are clear, culturally relevant, and reality-based. And Karen just provided a very good example with the survey. And we can help track outcomes, not just the weight or the lab values. We know that this clinically is very important, but it's also important the quality of life, the fatigue, the energy levels, the participation in daily activities, like I was mentioning, for us Portuguese, food and eating, being able to have these social moments is extremely important. It's not just about the right figures in the lab test results, it's also about how we live outside the medical office and how the 2 points are connected. So when we talk about implementing nutritional care policies, let's ask, were patients part of the writing team? Are patients' reported outcomes part of the evaluation? Are budgets aligned with patient needs and not just with the hospital structures? That's what true co-design means. Policies must be built with us and not merely for us, the patients. So I'm going to be a bit provocative here because we don't need another awareness campaign that ends when this webinar will close. We need to think about something more structural, long-term, sustainable. We need actionable, patient-centric public policies that guarantee that every person, regardless of the postcode, their income, or their own diagnosis, has access to the right nutritional care at the right time. And I emphasize the right time. So let's make patient voices not an afterthought, but actually a governance principle when we are talking about nutrition and when we are talking about nutrition care. Because when patients are partners in designing nutritional policies, those policies, they become real, they become reachable, they become sustainable, they become implementable. Thank you.
Vera, I think you really hit the spot on many key issues. So thank you very much. I think we've had three very interesting presentations, really leading the way into what we're now going to talk about, and that is how to talk to your doctor about nutrition. And to join us for these discussions, we have two more panelists. That's Robert Green, who's from the Patient Partner Consultancy, and also Tunde Kuldai, who's a member of the ANA board, but also an EPF liaison. Now, we did hear a lot of the basic questions were, I think, covered to a great extent with Karen's presentation of the survey, because I think for both Marek and Vera, these are, especially Marek, it's very obvious that nutrition is failing. And for Vera, I think the same is there. But for many cancer patients, it's not that obvious. So it was interesting to see that patients really feel the need for nutrition with the cancer patients. But I'd like to just forward that question real quickly to Robert to begin with. How much do patients in general, from your experience, actually understand the role of nutrition for their disease?
Well, thanks, and thanks for having me. A good question, and one that I do not have all the answers to, definitely not. But I think as I've listened to all the previous speakers, the role of the patient is extremely important. And it's not just merely understanding the nutrition is important, but it's translating that into action. So I think that's where we need to do a lot more work in not only just helping patients to understand, because we all understand that eating is important. We all eat, right? So we need to understand the importance of when we're suffering from a disease, that it's even more important. So education is key. And patient involvement, as Vera also mentioned, we need more patients to explain how important it is to not only just merely understand that it is important, but also how to translate that into actions. And only having patients talk and discuss about that, we can make that happen, I think.
And the language barrier here between patients and their doctors, your experience on what works and what tends to not to work from the patient's perspective, now that we realize we got to do something. I mean, and we just heard that 80% or 70-80% of the patients feel, the cancer patients at least feel, they don't care about this.
Well, I think that we need to educate patients, but there's also an important point that I want to make, and that nutritional care should be addressed proactively, and too often it's addressed reactively. So when there's a problem, then we want to educate the patient. So we need to change that. We need to change that, and patients can help in doing that by explaining, for example, to a physician or a healthcare professional that their nutritional state is important for their independency, for example. Because if you align it with your independence, I think that most healthcare professionals will address the issue and avoid, in my opinion, from asking questions, should I continue eating the same thing or should I change my diet? It's just too easy for a healthcare professional to say yes or no. But if we explain that we want to get more information so that we can become more independent during our treatment, then that would probably stimulate the healthcare professional to go more in depth in giving an answer and advice.
Well, being a healthcare professional myself, I think one of the things that we also need to understand from our end is our limitations in the knowledge, and we need to have to understand. Okay, so this is not really my ball game because this is getting complicated. I should make sure that this patient gets some specialist advice and refer them correctly.
I totally agree.
Yeah. Well, Karen, from your work with patient networks and the surveys that you've been doing, the barriers that patients would be reporting in initiating getting this conversation going. I got the impression from the survey that people don't even listen to them when they come with their. What can we do about that, or what should we do?
Yeah. I think there are various barriers, but one big, huge barrier from our perspective is time. I mean, we all know that time is limited when we go to see our healthcare professionals. The waiting rooms are full. It's packed. You need to wait a long time. Then you have maybe 10 minutes, 15 minutes. And then seem to be more important topics like, is my disease progressing? Is the therapy working? So nutrition comes at the end. And we also see, like Robert said, that often healthcare professionals don't proactively ask if patients have problems. And the patients often have a fear that they don't want to speak up because often nutritional problems are related to side effects. And sometimes they're afraid, like, if I mention the side effects and my problems I have with nutrition, maybe my therapy will be changed, but it's working. So I don't want to be, I want to go down that road. So we also need to create awareness that when you're speaking up about your problems, that doesn't mean your therapy will be changed. There will be differences in your cancer therapy, but it could help you with your side effects, maybe. And also sometimes it's a problem of communication, as we already mentioned before. Robert said something like, should I change something in my nutrition? Then doctors often just say, oh no, you can eat what you ate before. I mean, they probably think from the healthcare side. I mean, your system is working, you can eat, your food will be digested, but it doesn't help in the psychological sense that patients want to change something because, of course, on their way to the disease, they must have gone something wrong. And sometimes they think it has been nutrition related. Maybe I got colon cancer because I ate the wrong things. And when I ask my doctor and he tells me, oh, you can eat what you ate before, then maybe that's not the right sign. And also when it comes to terms like light diet, when you have diarrhea, the doctor tells you, oh, just keep a light diet. What does that mean? What can I eat? What can I not eat? Should I go buy just light products in the supermarket? Or what is it? Is it just rice? Is it bread? So sometimes it's a communication problem as well. So I think we need to educate both sides, the doctors and the patients, on how to communicate on nutrition.
Yeah, well, I'd like to extend that question a little bit more to Vera because you were also pushing for the involvement in policies. But on the day-to-day basis, when the patients are feeling that they are, well, this is not working. My normal eating habits is not functioning. What's your advice, and what should the patients be pushing for? What arguments should be using to actually get the clinicians to listen up and to do something about it?
Yeah, that's actually a very good point, because indeed sometimes for us patients, it's a lot about feelings and emotional than actually facts. So we are having in one side an emotional person, an emotional led person because he's suffering, he's pain, he's having struggles, and on the other side we have someone that is very rational, very objective in what needs to do and to assess. And there, my advice is data. Move from emotions to facts. So patients can bring concrete examples like food diaries, for example, the symptom tracking, the weight trends, because this will give also the clinicians something objective to work with. It brings the facts for that clinicians need also to do their job. And I agree with what Karen was saying, because that is actually for IBD patients, that's the first thing that we ask when we get the diagnosis is, what about food? What can I eat? And we often hear, not to say 100% of the times, you can eat everything. But what is everything, right? What is the light food? What is keep healthy? Yeah. What is healthy? Healthy is very relative. I can give my personal example. If I eat soup, I get extremely sick. If I eat a pizza, I'm fine. So healthy can also be very personal. And so bringing the facts and then also have this clear language that we need to pair the language of the patient with the language of the clinician. That will help to have a positive output in the 10 minutes medical appointment that we have. It can be things like, I'm worried about my energy levels. I've lost 3 kilos in 2 months or more even. And this will also help to move the conversation from the feelings, from the emotional aspect to the facts. And there is where personal data can really help, I think.
Okay, thank you. Tunde, from your policy and advocacy perspective, what are the changes at the institutional or system level that would make, taking nutrition as a natural part of clinical consultations rather than just an optional thing?
That's a very important question. I think that, and we need to make differences between the patients and the public, general public nutrition, how they working and how they understand why it's important to eat healthy. What does it mean healthy? What can they do for their and their families' health condition as the nutrition, and giving another point of the discussion. I think that nutrition must be much deeper involved other policies. For example, the agricultural policies, the food industry policies, and this is not a simple question between the patient and their doctors. And if we are speaking about the language gap, it's also needed to translate the advices for patient and the general public into lay language and national language. So that's very important to get understanding from the general public. And very important on the other side from the patient organization side, that we need to we are speaking always capacity building of the patient advocates and the leaders. We need to also involve the nutritional as a topic to the capacity building programs.
I think those are very, very important points, definitely. So it's really working at every level. So again, coming back to the doctors, Robert, there's a gap between doctors listening. We heard Vera discussing that bringing facts is really a strong factor. Is there anything else that you would like to add to that to make the doctors listen?
Well, Before I answer that, one thing I want to mention is that what Tunda just said about the general public, I do believe that maybe we should also try and get a shift where when the general public is being informed about nutrition, it's about staying healthy, and maybe we should try and get the message also in that nutrition is also important during a disease. So at least we try and get both messages in. Not only important to be healthy, but also important when we're not healthy. And coming to your question, I think that like having a stakeholder group where patients come together and create all these innovative ideas on how to communicate best to other patients, very important. And I think we cannot achieve as much as we want to if we do not get nutrition to be at the beginning, from the moment of the diagnosis, that it should be addressed. But what I think that we need to look at, from my opinion, is that we need to see who do we need to reach out to achieve the quickest win possible. Is it a nurse? Is it the doctor indeed? Or is it the dietitian? Is it the receptionist? So who do we need to reach out to within that entire cycle to get the quickest win possible?
Yeah, I think you put the finger on many important things here, really. And as a doctor myself, I think the using numbers is always going to be helpful. I think the Vera really put her finger on some of the key issues. And also, but what I think is really lacking is the fact that people, the doctoring, people like me are more focused on, the disease itself and not the everyday life. And I think that combination needs to be brought to everybody's attention. So now, as we're getting to a close, I think we should try to summarize a little bit about how organizations can help members to feel more confident in asking nutritional issues, to bring it up, and how we can get across with all these things that we so clearly see are missing. So Karen, a few words about that, perhaps?
Yes, thank you. As we already said, I think it's important to educate patients, to educate our members on the topic of nutrition along the cancer journey or the care journey for whatever disease. We can give out leaflets, brochures, tips on websites, but I also agree with Robert that it's not only a topic that needs to be tackled from the patient side or the patient organization side. We need to bring all stakeholders at the table, and we need to drive policy change. There needs to be screenings need to be implemented, not just mentioning guidelines. Patients need to be referred to experts. I mean, if you say you're a doctor yourself and sometimes you don't know what to say, maybe just refer them to a nutrition expert. So I think policy change is important, and nutrition needs to be an integral part of cancer care, not just a side note.
Yeah, I think we should really focus on this patient and nutrition impact group. I think this could be a way to really move things forward, where we can all get together. Certainly, I mean, it's in the name of the whole thing, that it is a patient impact group, and I think that's key, because I think the understanding of what this means for the whole situation is really what is missing. I think we're moving towards the end here, and I think I'll just hand over to Karen for the last words, and thank everybody for their contributions today. I think it's been a very enlightening and very good session, and I hope this can be a really good start for the work that we're moving ahead. Thank you.
Thank you. Thanks everyone for listening, for joining us, for dialing in. And I just want to say, I think establishing the patient impact group is a huge step forward. And everybody out there, all the patients, patient advocates out there, if you're interested in nutrition, if you're interested in the topic, please feel free to reach out to us, to join the group, reach out to either Enha, Onka, myself, or whoever was talking today. So we hope to see you soon. That's all I can say. Joost, some words from your side?
Thank you very much for sharing this important group, Karin, and Professor Lundquist also for chairing this session today. Indeed, please contact us. You can contact us at the secretariat at europeannutrition.org or contact one of the speakers that you might already know. And this will certainly have a strong follow-up, not only at the Policy Summit 1st of June in Paris, but also in the lead to that and well after that. It will be a very structured approach, I hope. And thank you for all your contributions.